Yes, it actually looks like the resistance that we're observing in Aspergillus has emerged as a result of the use of azoles in agriculture. Because there are so few drugs available to treat any kind of fungal infections, we actually use the same azole drugs on crops that we would plan to use on our patients when they get sick. And in areas where there's a lot of azole use, we find a lot more resistant Aspergillus in the environment, which increases the risk of our patients turning up with an infection that we can't treat with standard therapy. So it's a real concern. And no one's even begun to look at this problem in Southeast Asia.
In Vietnam, the agricultural chemical industry is fully regulated. Company agents sell azoles directly to smallholder farmers. Azoles are being used a lot in Vietnam, so it's likely that azole-resistant Aspergillus will be common. This, combined with Vietnam's high rate of tuberculosis, is a real concern. So this year we started to sample the environment in Mekong Delta to better understand this risk. Our results so far show higher rates of triazole resistance than have been detected anywhere else in the world. The resistance rate we are seeing is more than 50%.
Our results so far, they really are of concern. And our next steps are to finalise those, to really nail down the instance of resistance, and then to find out not only if this is a problem in the Mekong Delta, but is a problem across the rest of Vietnam and the region. Ultimately, we need to work out how much of a risk these resistant bugs are presenting to the people that live in our region.